I think our practice is, it's very focused now on aesthetics, both of the skin and surgically. So that's probably the biggest evolution over the years. We used to do a lot more reconstruction and medically based treatments, and now it's a lot more aesthetic in nature.
And I think at the beginning we always bounced things off of each other and talked about things, and then would try to coordinate and see how those two things fit together, because sometimes I'm not always the right person for a patient. It sometimes is a surgical option.
I think it's a refined process now.
Yes.
We've been doing it for so long. I know what she's thinking, she knows what I'm thinking, and we have patients that we've had for a long time, and patients trust us, and so we routinely get that, or they'll say, hey, if you say that's what I should do, that's what I should do. We're not going to do it just because I can. If I don't think it's going to benefit them surgically, and I think they can do something more from a dermatology, skin treatment area, then they'll do that, and vice versa. And so ultimately, we're just going to give the patients the best treatment plan, and we know how each other think very well at this point.
Yes, at some points I say, I knew you were going to say that.
Yeah.
But I still ask him just, because things they're fast, they move, they're evolving. And so it allows us to evolve in our own specialties, and then be able to bring that back together so that we're both, always on the cutting edge, moving forward, combining them together, so the best outcomes for the patient, basically.
And so you really are on the cutting edge of both specialties, and ultimately that's just best for the patients, because we live in our own little worlds, but we're in both worlds. And so I can, not that I'm a dermatologist, but you have that insight that you wouldn't otherwise have.
They know me and they know him by extension, and so it definitely allows us to start at a place of trust, for sure.
I think in our practice, a lot of the times, if I have surgical patients, I'll do a facelift, we'll do eyelid surgery, and then they need maintenance treatments. So they're gonna need microneedling, lasers, some filler, some Botox, all of that stuff to maintain their long-term result. And so I basically, transfer the care over to her, and then she takes over for, after that, so that they can maintain the result. And I think on the opposite side of that, there are patients that come to see her that will say, I want a laser, and they're going like this, and you say, no, I think you need a facelift first. So yeah, it works both ways.
So it helps us get everything in line for the patient in the correct order, and then also in their best interest for time, money, energy, and number of visits.
The beauty of our practice is I really can focus on surgery, she can really focus on skin. And that's unique, because a lot of plastic surgeons are kind of pseudo-dermatologists, and a lot of dermatologists are pseudo-plastic surgeons. And the reality is you're best if you do something a lot, and you know it very well, and we do.